Good afternoon. I'm Sarah Foss, an Executive Director of Minnesota Citizens for the Arts. Thank you for joining this important conversation today. Minnesota Citizens for the Arts is the oldest and most successful arts advocacy organization in the United States. We're currently working hard to pass a $100 million COVID relief bill that would benefit 1,400 arts and culture organizations across the state. We have a way to show your support through an online petition, and we're doing an in-person rally at the Capitol on May 5th. This bill will help the 57% of the creative sector who was laid off because of the pandemic get back to work. Please visit our website at artsmn.org to take action today and to help your organization and others get back on their feet. Thank you again for joining today. It's my honor to introduce Kimberly Moats, Managing Director at the Children's Theater Company.
Thank you. Good to see everyone. Thank you to Sarah and Mark Albers and Minnesota Citizens for the Arts for hosting the webinar for us. And it's great to see such strong interest in this session. I am pleased to introduce Dr. Michael Osterholm, who is the Regents Professor, McKnight Presidential Endowed Chair in Public Health, the Director of the Center for Infectious Disease Research and Policy, Distinguished Teaching Professor in the Division of Environmental Health Sciences, School of Public Health, Professor in the Technological Leadership Institute, College of Science and Engineering, and an adjunct professor in the medical school, all at the University of Minnesota. Dr. Osterholm has been and continues to be a go-to expert for many media outlets, industry groups, and it was part of President Biden's transition COVID advisory board. He has been very generous in spending time with our arts and culture industry, and it's so good to have him with us again. Dr. Osterholm, thank you for joining us. You have spoken twice to this group of arts and culture leaders over the past 2 years, and your perspective has been incredibly beneficial to us. We've also listened to you on various news programs and looked to your website for information as we have navigated the pandemic and its devastating impacts on our organizations. Unfortunately, we need your continued wisdom as we navigate this particular phase of the pandemic. Many of us have been open for some time. Most performing arts organizations reopened this fall for live in-person performances. Audiences were excited to return for the most part, and most of us put rigorous safety standards in place that included proof of vaccination or a negative test within 72 hours and mask wearing in our lobbies and in the theaters. Audiences and our staff reported feeling safe and cared for. At the end of December, early January, the rise of Omicron created a huge challenge again that resulted in performances canceled, runs of productions postponed, and all of our audiences retreating back to their homes. As Omicron receded in February, March, people have been returning, but we're not 100% back. So look forward to some opening remarks from you, and then I have a series of questions. We also ask those of you participating in the webinar today, feel free to type your question in the chat, and we will try to get to as many as possible. We have a hard stop just before 12:45. Again, our thanks, Dr. Osterholm, for being here.
Well, thank you very much for having me. I appreciate it. And like many citizens in this country, we recognize that as goes the arts, goes this pandemic. And so that, in fact, when the arts are vibrant and live, when they are a part of everyday lives, that's a signal that we have a lot to be celebratory about, not just the fact that the arts are here, but that we have, in fact, are effectively dealing with this pandemic. Right now, it's a challenge. I would start out by prefacing my remarks with two comments. One is that no one should be in this business today dealing with this pandemic in terms of trying to provide leadership about what has happened or what will happen without one single quality, and that's humility. Humility is so important. I swear to God, there are days that when I wake up, I know less about this virus than I did 6 months ago. And so today I'll try to share with you what we know and what we don't know, what we're trying to learn as fast as possible to help provide more clarity as to what's going on. But if I say to you today on multiple occasions, I don't know, I hope you'll accept that as just an honest answer about where we're at. The second point that I think is really important in setting the tone for this presentation is we are, as a society, frankly, in many parts of the world, done with this virus. We're done. The problem is the virus isn't done with us. And I think that's a recognition that we have to have, because it says so much about what can we do, what should we do, what might we do, what can't we do in terms of responding to what this virus is all about. You know, it's a sad moment to think about the fact that if you just look what it's done in this country alone, and you take all the some people who have died of COVID, and if I were just to say their name on the stage of your theater once every 3 seconds, I could do for over 18 days consecutively and say just one name every 3 seconds. That's a remarkable, remarkable comment on where we've been in the course of the last 2+ years. So where are we at today? Well, as everyone knows, we've surely seen our ups and downs with the previous surges of the virus. I think that now we're willing to accept the impact that this can have. And what I mean by that is, who would have thought, the fact is that for the last 2 years almost, I have been reminded frequently that if we just did it as well as Hong Kong or China, we would be in a very different place. Now, with Omicron having hit Hong Kong so hard, they are now reporting the highest case fatality rates in the world for their population, twice as high as we had in the US. What an amazing change in position. You see what's happening right now in China, where the country is virtually in lockdown in many areas, including metropolitan areas as large as Shanghai, and things are not going to get better anytime soon. They have a population of those over 80 years of age who have not yet been fully vaccinated. That population alone, if it were a country by itself, would be the 10th largest country in the world. There are more people in China over the age 80 not vaccinated adequately than live in all of Japan. So you can see that we're still going to have challenges around the world, but the real question we have is what's going to happen here. Well, we've been through a whole series of surges of this virus. And I must say that it was a year ago right now that I actually was saying publicly at the time that I thought that potentially the darkest days of the pandemic could be ahead of us. That was following a big January peak in cases, with cases that started to fall very, very quickly, dramatically, in fact, and vaccines were flowing. But I saw what the variants were doing. I saw the Alpha, I saw Beta, I saw Gamma. And, as I kept considering this, I thought, what else is next? These variants can be more infectious. They can be able to evade immune protection from either vaccine or previous infection, and may even cause more severe illness. That wasn't a very popular statement at the time. In fact, quite to the contrary. I was, you might say, an outlier among my colleagues, and surely many in this community. And then along came Delta, and then along came Omicron. And I think it's just a stark reminder that, again, we're not done with this virus yet, as much as we want to be. So let me address that specifically. What's going to happen? Well, if you look at the previous surges that we've had, starting back in the original Wuhan-related outbreak in 2019, in that November, December time period into early 2020, we saw at that time cases show up in relatively isolated geographic areas. New York City got hit hard, parts of Detroit, New Orleans. We saw it in Europe, but on a whole, many places in the country had not been really touched by COVID. And there was a sense that, we locked down everything, which I think at the time was a mistake because it was not proportional to what the risk was. When you're in greater Minnesota and you're shut down and mom and pop's hardware store can't operate, but the big boxes can operate in St. Cloud, and there are no evidence of cases in our community, you begin to wonder what was going on. This isn't right. And that began what I would call basically the development of the anti-COVID world, where people were feeling like somehow we were foisting on them issues around prevention that were mandates and so forth that didn't necessarily equate to the risk. Well, but we moved on then. And then we got to a period during the summer where it looked like it was going to be kind of quiet in 2020. Only to find out, of course, then that at that point, no, it wasn't. We had surges that occurred. They occurred regionally in different parts of the country. And it was not clear, why the Southern Sunbelt states would light up like a fireworks. And yet Other parts of the country were hardly touched. And then suddenly we saw Alpha, a variant that arose originally in Europe, particularly in the UK, come to the United States, last spring with the idea, oh my, is this going to be a big challenge like it was in Europe? And only Minnesota and Michigan got hit, and we got hit hard, but nobody else. I could go on and cover these other surges that have happened, but we don't really, at this point, understand why the virus does what it does. Let me take Delta, which, as you well know, emerged last spring in India. And there we saw a very, very sudden rise in cases, a big peak of cases. And then it came down relatively quickly, what we call a classic bell-shaped curve. And it came back down to baseline. Well, that's exactly what happened in the southern Sunbelt states the second summer in a row. Delta took off, and we saw this big increase in cases, and then it came down quickly. And many other parts of the country were hardly touched. Then you had the situation that happened in the United Kingdom, where cases took off in July of last year. They went from 1,500 cases a day to over 52,000 cases a day. And then, but started coming back down again, very similar to what we saw in India. But then it got to about 26,000 cases a day and it stopped. It leveled off. It went back up. And it pretty much persisted at these high levels well into November, when finally Omicron displaced it. Wasn't that ironic? That's what happened in Minnesota. That's what happened in northern Wisconsin, in Michigan. That's what happened in the southern Ontario region. That's what happened in the far northeastern states of the United States. Also, it happened a bit, as we saw, in the Rocky Mountain region. Other areas of the country were not touched. New York and LA virtually had no Delta activity. Why? We don't know. But the bottom line is all that changed when Omicron developed. Omicron was anywhere from 30 to 80% more infectious than Delta. Delta was at least 40 to 50% more infectious than Alpha, each one just getting more and more successfully infectious. And when we saw Omicron emerge in Southern Africa, it was clear that we had a very different virus. And in fact, back in November, I labeled this as likely to cause a viral blizzard, where it was going to be everywhere, potentially displaced by time, weeks, but not years, not even months. And the bottom line was, in fact, that's exactly what happened. We saw it spread quickly around the world. And you saw what happened here. We saw that it did cause immune evasion, that people had previous protection from having been vaccinated with up to 2 doses, and people who had previously been infected themselves still were at risk of getting infected again. Now, grant you, the more doses of vaccine you had on board, 2 and particularly 3, it was much less likely to develop severe illness, hospitalizations, and deaths, but you were still at risk of getting infected and being infectious. We continued to see the major impact it had on our healthcare system. We often heard Omicron's a mild disease. Well, let me put that into perspective. If you have 1,000 cases of Delta, the one that occurred last summer, you might expect 100 of those to cause severe illness, require hospitalization, and some of them die. 100 out of 1,000. Along comes Omicron, and now it's 10 out of 1,000. You say, well, that's a lot better. The problem is there were 20 times as many cases. So the absolute load, the force in our healthcare systems were overwhelming in what it did in terms of the number of deaths, in terms of the number of people requiring hospitalization, what it did to our schools. It wiped through schools. It wiped through so many different parts of our society. And now Omicron, as caused by what we call BA1, the subvariant of Omicron, basically has started to come down. And in this country, we've seen it come down dramatically from where we were in January. So what's going to happen now, though? Well, let's go look at Europe. Everyone's talking right now about this new subvariant, BA2, a cousin to BA1. And at this point, there surely are compelling data in parts of Europe where case numbers have gone up dramatically in association with increases in BA2. But at the same time, there have been countries where we have seen BA2 go up and no increase in cases, or no increase in BA2 and yet still increasing cases. What this all is really, if I could use an analogy, never forget that a broken clock is right twice a day. And in a sense, we don't really know yet what the relationship between BA2 is and whether we'll have another surge. If it occurs, where it'll occur, how much of the surge will impact those who have been previously infected or vaccinated, how many doses, is it 2 doses, 3 doses? Now, even with recommendations to consider 4th doses for all immune compromised individuals and the availability of vaccine for those 50 years of age and older for 4th doses. I can tell you at this point, these vaccines are remarkable tools, but they're not perfect. We're learning the fact that waning immunity is likely a very significant issue. We don't know what's going to happen over time with our protection. I do know that if you do have a 3rd dose on board and hopefully even a 4th dose for the older population, you will be largely protected against severe disease, hospitalizations, and deaths. But it doesn't mean that you, in fact, still won't get infected. I just was in a situation this past week where I was consulting with a group filming in London, where among the crew on this film activity, in 1 week, 29 of the crew became infected. A number of them had already been vaccinated fully. There's an example in the arts where that's a challenge. You're already hearing about on Broadway closings occurring again because now we're seeing this uptick in cases. We have at least 12 states in the United States where case numbers are starting to rise, but they're much lower in the rise. So when somebody says, well, there's been a 200% increase in state A, when you go from 2 to 4, 2 to 6, or 2 to 8 per 100,000, that's different than the numbers we had during Delta and Omicron, where we were seeing 125,000 cases per 100,000. So we haven't seen those large numbers yet. And the bottom line is, I can't tell you what this is going to do. I don't know. And anybody that does tell you what it's going to do, be careful, because they probably have a bridge to sell you too. And I think that's the important message that you need to take away from this. I know you want clarity. I know you want definition. I get it. I do too. I'm as tired of this virus as all of you. And so I hope that this basic overlay of where we're at right now, where we've been, I can address the questions you have. And like I said, where I know, I'll tell you. Where I don't know, I'll tell you that too.
Really helpful. Thank you so much for that overview. Yeah, we would love certainty, right? But it is that humility piece that you mentioned at the beginning. One question I have is, many of us are looking at the CDC and their recommendations as sort of our guide in terms of sort of how we might be thinking about this. In theater,
Yeah.
Actors Equity Association just aligned with CDC for us to sort of look at in terms of what requirements we might need to have for actors, for example. And I know many of us with audiences are looking at CDC as well. Could you just comment on, some of the, is CDC sort of the best place for us to look in terms of recommendations, and just any insights there?
Yeah. Well, let me just say, this is not easy for me to say, but it's, I think, necessary. CDC has had a real challenge through the course of this pandemic of putting out what I believe is scientifically sound information. And I say that in the sense that you can't use a statement where we're just following the science, when in fact it's not based on the facts of what we know. As you're well aware, in our previous times together here, I've talked about, for example, respiratory protection. And the fact of the matter is, we know that this virus is transmitted via aerosols, very, very tiny particles that just breathing. If someone were in this room with me now, me just talking, not coughing, this room is full of my aerosols. If you want to try and understand that, think of going to a department store and you're 3 aisles away from the perfume section, you still smell it. Think of you're walking down the street and all of a sudden you get this horrible whiff of smoke, cigarette smoke, and you see somebody 20 feet in front of you with the wind blowing at you and you smell it. Those are aerosols. Last summer, we had an incredible opportunity to understand how you prevent aerosol inhalation when we had all the wildfires in Canada, bringing smoke down into the Twin Cities metropolitan area. We had many people who were wearing face cloth coverings or surgical masks who felt like they were choking to death on the smoke. CDC was very, very late to the scientific roundtable on how this virus is transmitted. And this will be something that's going to need to be carefully evaluated in a post-pandemic review, because they really did provide, I believe, tremendously misleading information on how well you can protect yourself. I, for one, would tell you right now that even their current website, which now they acknowledge the aerosol transmission, actually provide terribly inadequate information, such that we have many hospitals, not venues like yours, hospitals, actually having to follow the CDC recommendations. And we have our own staff. We have people in many occasions that go into a hospital as part of work, and they're made to take off their N95 respirator and put on a surgical mask because that's the standard. That is about as unscientific as you can get. N95 tight face fitted respiratory protection is the minimum to keep you from either getting infected or from transmitting the virus. Now, KN95s, which are the Korean example, can be used. There's another classification for European. So people have often been surprised when they hear me talk about the fact I have never supported the mask mandates. I think that they are, in a sense, a joke. And I know that that's a very strong statement. But why? Because number one, wearing a face cloth covering a surgical mask does little to prevent either you from transmitting the virus or from you getting infected. Number two is that nobody enforces how they're used. We've been doing surveys looking at TV shots of evening news where we look at crowds and just systematically count since the beginning of the pandemic who is using face cloth coverings of any kind, masks, respirators, and how do they use them. And we have consistently seen from the very beginning of the pandemic, 25 to 28% of the people wearing it under their nose. Well, that's nothing more than a chin diaper. That's like basically fixing 3 of the 5 screen doors in your submarine and expecting it's okay. And yet that's been part of a mandate norm. Restaurants, who would really honestly, logically believe that the virus would only transmit when I'm not eating, but when I'm eating, it's gone. It's not there anymore, okay? So I don't have to worry about it. How illogical is that? How illogical is if I'm sitting there drinking with my respiratory protection off? And we have seen so many large group outbreaks. And you want an example. In the earliest days of Omicron, one of the outbreaks that was remarkable, but yet not uncommon, was one that occurred in Norway, where a company had a holiday party. And it so happened that everybody there had to have 2 doses of vaccine, and they had to be test negative in the immediate time period before coming to the party. Someone arrived from South Africa who met all those criteria, went to the party in a large ballroom that night, and with 170 people there, at least 125 got infected that night, all from that one individual. Now that is dynamic transmission. So, I know you don't want to hear this, but this is that potential. Now, if you're lucky and no one is in the house tonight who is basically infected or infectious, nothing will happen. But I can never tell you that. And with Omicron in particular, you're seeing this high level of infectiousness. This is why on January 28th, I wrote an op-ed piece in the New York Times saying that China was about to meet its match, that they could no longer adhere to a zero COVID policy. Previous variants were much less infectious, and it was like stopping forest fires. They will burn, but you can stop them. And with the less infectious variants, with the zero COVID policy, they could lock down enough to stop it. But with Omicron, it's like the wind. You can't stop the wind. You can divert it, but you can't stop it. And that's what's happening right now. They can't control what's happening in China with their zero COVID policy by doing that. So going forward, I don't know what's going to happen. We know that waning immunity is real. We know that it surely can reduce the protection you have from previous doses of vaccine. I very strongly support that 3rd dose. And, as someone who's over the age 50, I have my 4th dose now. I would encourage others to get it, but I can't tell you how much it's going to protect you or for how long. This is an area where we're still really, really learning a lot quickly. So we all want to move on. We want the vaccines to be there. We want them to be effective. We want the virus to go away. I don't know what's going to happen with COVID. Just as I said a year ago, I don't know. And at that point, I worried. We could see a new variant arise tomorrow that could be much more infectious than even Omicron, that could evade immune protection. And we might not. We don't know. So I think the bottom line message is that you asked me about CDC, and I realized I went on beyond that. But the bottom line is I have a lot of concerns about information that CDC's put out. And that's really been a tragedy for us in public health. And I'm not alone in that at all. Trust me. CDC announced yesterday that they will be doing a review of their own internal programs because of the challenge that have occurred. And if you want to get an understanding of this, the head science advisor in the White House in the Office of Science and Technology just put out a blog piece last week talking about the importance of aerosols and transmission, basically, in a sense, overriding any message the CDC had, and that came out of the White House. So I would leave you with the fact that there is a document that you may want to get. It's available on our website. I was part of a roadmap group, a group that had been part of the Biden-Harris Transition Team Advisory Board, and a group of other experts came together last month. And we put together this roadmap. If you just put roadmap COVID in our website at the CIDRAP in the search, you'll pull it up. And it's actually a detailed document really talking about all the areas of questions, what we need to do, what programs need to be conducted, issues around schools, ventilation in buildings, etc. And I think you'll find that very, very helpful. And I might add that the administration has really wrapped their arms around this document and have been very much trying to support it. Now, having said that, we are finding it very hard now to get any additional appropriations out of Congress to try to even do a lot of this work.
So what I'm capturing from you is the N95 and KN95 masks are important, and that is the best sort of protection. And so as we think about audiences and we think about people coming into spaces, what I'm hearing you say is hold to that mask wearing of our audiences.
You know, you can, and I think what you do is you do two things. One is you actually really do protect those who are infected from transmitting to others, and you prevent someone who is not infected getting infected, and it can be very effective. So if I'm that 65-year-old individual who is concerned about what happens if I get infected, I've had 3 doses of vaccine, or, you can take it upon yourself to protect yourself. And I think that's such an important issue. So we want to give people confidence. We don't want them to hide away in their homes for the rest of their lives. This has by its own self created so many real and critical mental health issues. And so there's a step I can take. And not only will I have my vaccine on board, but I'm going to protect myself that way. The one caveat I would say is that you got to use them right. Don't let it go under your nose. It's a chin diaper. I think we ought to put an ordinance in place. Everybody who has a chin diaper gets fined $2 or something, just to make a point. The second thing is that I will have to say also with men, this is not a popular statement, but facial hair totally invalidates an N95. Okay? It's like having that really great swim goggles you love, except they leak like hell around the seam. Okay? If you have a beard on, N95s are not effective.
Yeah, that's helpful. I mean, I think we're all seeing, this environment where, restaurants are open, large, the stadiums aren't requiring masks and aren't requiring proof of vaccination. And I think as a lot of us, especially in venues in the performing arts, are grappling with, do we mask mandate? Do we continue to check vaccination status? Or do we leave it to our audience to make their own decisions?
Yeah, and I think that this is a very important point also that I didn't add in terms of context, is that we are in a quiet period right now relative to what has happened. And so the risk of transmission in our communities right now is substantially lower than it was 8 to 10 weeks ago, but it's not zero. And I think the challenge we have is for some people, this is still a fatal disease that is going, if they have risk factors. So this is where getting them vaccinated, having them basically wear that N95 respirator will protect them so much more. But be prepared. This could change overnight. I have to say right now, let's just be completely honest here and say, when the recommendations were made to withdraw these mandates, none of them were made by public health. Public health didn't come onto the scene till weeks later with criteria about what might be the triggering reason for releasing mandates, okay? The decisions came from the governors who were reading the tea leaves, who said the public's done with this. They are. And that's a reality we have to understand. And, in public health, you have to have the support of the public to carry out many of the activities we do. And if the public goes like that, then what can you accomplish? So we also need to understand this pandemic fatigue. We also understand, how do we share with the public, okay, now's the time to roll like hell. We're going to hopefully not go over the waterfalls if we roll right now, as opposed to telling them they got to roll for 5 days in a row. And I think that that's also going to be something we in public health have to do a better job of saying, okay, case numbers are starting to really go up. Virus is in our communities. Our wastewater data is telling us it's here right now. For the next few weeks, you guys want to really be mindful of that and take that into consideration when you do, with the idea that's not going to last forever. We'll see cases go up and down. Keep following what's happening with these new variants. As I sit here and talk to you today, a month from now, it could be totally different if a new variant emerges, or it could be better. And that's, I think, the challenge we have right now.
Yeah. And any news that of vaccinations for kids under age 5? I mean, that is the one group that doesn't have access yet.
Hang on. I think you're going to see information on that coming soon. Okay.
Okay.
And, I think that's the other example I want to say is there was so much misinformation about kids and the risk in kids. When you looked at the earliest days of the pandemic, it was very obvious that kids were not getting hit hard with those early variants. And I couldn't explain why, nor could anyone explain why. They just didn't seem to a lot of transmission. It wasn't serious. That all began to change with Alpha. And right here in Minnesota, we indexed some of the very first activity, particularly in youth sports. That was a year ago last April. And we started to see this happening. And it was really important to understand that the variants were acting differently in kids over time, such that by the time you got to Omicron, it really was highly infectious in schools, and it was causing major outbreaks in kids. Our hospitals, pediatric hospitals, were overrun with very sick kids. And we have to understand that this isn't just a simple infection in this group. Yes, the rate of serious illness per 100 kids, per 1,000 kids is lower, but the number that got infected, literally hundreds of thousands of kids a week. And to say schools were safe was absolutely at that point ridiculous. More importantly, we were making up stories almost to say, well, we're going to keep kids in there because it's a safer place. Right. And you had the janitor serving as the teacher that day because 40% of the teachers were out sick. If this was a real blizzard and 40% of the teachers couldn't be there, would we have had school? No, but we insisted we're going to do it with this variant. So I think one of the things we also want to rationalize is, how do we understand risk? When do we actually make decisions to do something or not to do something and not get into the emotions? It's either safe or not safe. No, all of life is not safe or unsafe. It's a variation. And what we need to do is, even with kids, is lay that out as such.
So it's really looking at these quiet periods. I mean, I guess one of my questions for you is, at what point are we moving into endemic stage, and where things will sort of, maybe it's a new normal. I've heard you talk about a new normal before, but is there a point at which it's like, it's going to be like cold and flu, right? Where there's always sort of a cold sort of circulating around.
Yeah. Kim, you're starting to use words like epidemiologist. We're going to need to hire you pretty soon.
Well, I've learned a lot from you. We all have in the arts.
No. Well, first of all, let me just say, I've written 2 books and hundreds of papers involving pandemic, epidemic, and endemic disease. And I don't know what in the hell endemic is with this, okay? And I don't know because every new variant could come out of nowhere and suddenly change all that. So let's say Omicron calms down here in Minnesota and we don't see much activity for the next 4 months. Is that endemic? Well, I guess it would be till we suddenly see Pi show up in October and it's Omicron all over again. And that's the challenge we don't yet understand, is what that's going to look like. How much immunity will we have? If we look at other coronaviruses that cause colds, for example, unfortunately, the immunity is kind of waning over time. So you get it, get susceptible within a year or two, and you get it again. And what we're trying to understand is what that means here. Now, that's very different than with influenza, where when you have a pandemic there, you run, 1 to 2.5, 3 years. And by that time, the population has largely become immune to that particular virus, and it doesn't keep coming back in big surges. But with this one, we don't know. And this is part of the uncertainty, and I said, I don't know. This is one I don't know. So I don't know what endemic is. And maybe it's going to follow up on that definition of our great Supreme Court justice who once said, I can't define pornography for you, but I know it when I see it. Maybe I'll just one day say, well, I think this is endemic. I see it now, but I don't know. So you have to be prepared for the unexpected. And that's going to be a norm that is not satisfactory. It's very uncomfortable, but it's reality.
Yeah. Okay. I'm hoping for endemic.
Okay. Listen, I will hope as much. I would vote for you every day of the week for that. Okay.
We have a question from somebody about, this. We went from, as employers, a 10-day, if somebody tests positive, waiting 10 days to the 5-day, and then wearing a mask for the other 5 days and returning to work. Would love your perspective on that.
Well, first of all, let me say this is one time where CDC made a decision that I actually supported and actually was part of bringing about. I raised this issue. When Omicron first was emerging, I saw this viral blizzard occurring. And my really very, very real concern was, what would this do to our healthcare workers and essential workers in general? And, if we suddenly had 10 to 30% of healthcare workers out infected, we would see a collapse of our healthcare systems when they were being overrun even more. Same thing is true with essential workers. We still need to get food. We still need to have a lot of things done. So what some of us supported is that it's not ideal, but if someone were only mildly ill with COVID, could we get them back to work as soon as possible, even within several days of their onset, with an N95 on? And in particular in hospitals, cohort them with people who are there for COVID. You can't infect them, they're already infected, okay? Right. At least would relieve the pressure so somebody else could go work in a cancer ward, or somebody else could go work in the newborn nursery, et cetera. And so that recommendation was never based on science in the sense of saying, well, don't worry, it's 5 days now, you're not infectious, which we used to say was 10 days. For most individuals, they still probably are infectious 5 to 8 days, at least after they've had onset of their symptoms or first got infected. But the amount of infectious virus is dropping over time precipitously. And so, to be safe, 10 days is clearly ideal. 5 days, if it's a challenge where you need to have something done, essential services with N95 respirator, I'd say yes. But the bottom line, again, is there's no magic bright line, okay? There's nothing that says that there. And I would rather not have people working who were found out that they were infected today. But on the other hand, if that meant somebody was going to lay in a bed for 8 hours and not have a single nurse or nurse's aide or a physician be there with them, I'll take the infected healthcare worker any day, and with their N95 on. And that's what that was about.
Great, thank you. A question that's come up, and it's a question I have too, your sense of, many of us have vaccination requirements as a way, right? Vaccine lowers transmission, if I'm understanding correctly.
You are, yep.
So is your sense at this stage where we are today, we're in a lower infection rate, a lower positivity rate, all of those indicators, should we be continuing to require vaccination? Or do you think that that's something that could relax a little bit for theaters?
I think in most cases, I think that we're not going to see a major transmission phenomena with this low levels, but that could change overnight. And so one of the problems with the public is they feel like they're getting bounced around. One day it's this, next day it's that. One day it's this, next day it's that. And we just have to understand the psychology of that, okay? I do believe that, unlike what I said about vaccine mandates, mask mandates, I do think vaccine mandates have been very effective. And you can do a lot to reduce the severe illness, hospitalizations, and deaths, as well as reducing transmission. Somebody who is vaccinated still may get infected and have some infectiousness, but likely a lot less. And so that basically helps protect others. So, I understand the political charge around this issue. Probably the hardest part for me during this entire pandemic, very, very hard, is I have had several close friends who decided that vaccination was not something they would do because they were never going to have anybody tell them what in the hell to do. And those individuals are now dead from COVID, and they were dear friends. What good was I? I was useless. I didn't change their mind. I didn't change their position on this issue. And I think we have to recognize that's a reality. There'll be those who will just say no. And society, how do you deal with it? That's a hard situation.
Yeah, I think you're pointing toward there is the psychology, right? And sort of people being done, but the virus isn't done with us yet. And we're public organizations, public facing entities. And so, we have just probably sort of a final statement from you in terms of.
I have to say, there are so many people that we have to thank immensely during this pandemic for what they've done. Healthcare workers is an example, essential workers that got us our food, that got us the things that we needed. And I still come back to the fact that the group that I want more than anything to celebrate is the performing arts and all that goes with that. I think that is such, the arts will define when this pandemic is over. Then I'll know when endemic is, okay? When in fact, we're all gonna feel that we can be there. And so, for all of you who've had to suffer immeasurably because of this pandemic, I'm so sorry. I know that it's really, really been a challenge. But at the same time, I don't want you to think that those of us in public health have thought less of the fact that you're not there. We do, we think about it. And I will use this as my North Star. When you are in a great place, I know I'll be in a great place. And that to me says everything about what you all represent.
Thank you. Thank you so much. This time went by very quickly, but I have to thank you because, it was June of 2020 when we first learned about aerosols in the air, and it was this conversation. And I remember, we were pretty devastated in terms of the very nature of what we do, right? We have singers, we have talkers, we have, people coming in space together, but it really has helped that you've helped us immensely get through this period and will continue. So thank you for being willing to spend some time with us. We'll probably ask you again. Maybe we'll say, are we at endemic? And we can celebrate that together. But thank you so much for all you're doing for Minnesota, for our industry, and for the country. Take care.
Thank you. Have a good day, everyone. Stay safe. Stay safe.
Thank you.
Bye-bye.
Thank you, everybody, for being a part of this conversation and for tuning in. And I think Minnesota Citizens for the Arts will have this, has recorded this so that we can listen to it again and share this information more broadly. Thank you all so much for being here. Thanks, Sarah and Mark, again, from Minnesota Citizens for the Arts for hosting today's webinar. Take care.